Thank you all for joining me for a second one of these. I actually got a couple of requests. I'm glad to see the people that requested this are actually here. That's comforting. So tonight we're going to talk about a variety of things, including roller coasters, cows, roulette wheels, and crystal balls. That's how we're going to divide up this hour together. And it is all about COVID, but we're going to focus this in individual units. So what I'd like to do is first set just a couple of very simple ground rules for us, and then move on to talking about where we are in the pandemic. So just focusing on the virus without talking about the vaccines yet. So just focusing on where we are in the roller coaster of a number of cases and unfortunately a number of fatalities. Then we're going to talk a little bit about herd immunity. We're going to try and challenge some of the ideas that you have about this magical number that we're supposed to achieve. And that's going to be our entry point into talking somewhat about vaccines. And yes, we will talk about the J&J vaccine, as well as the other RNA vaccines, which I think we spent quite a bit of time on last time. And I don't think it's fair to be on this call without some predictions. So understanding that I don't, in fact, have a crystal ball, but I have some guesses about when we can return to whatever normal looks like or pre-COVID time looks like. I think that was, I know, a request of at least a couple of you. So I'm happy to do that. So that's the outline for the evening. And what I'll do is stop after each one of those units and find out if there are particular questions. So we'll try and keep it organized rather than just have a complete free-for-all of questions. Does that sound organized and reasonable? There's a couple of nodding heads. Okay, lovely. So here are the ground rules. This is not at all political. And I'm frustrated that the whole discussion about the pandemic has been so politicized. I mean, for heaven's sake, if we can imagine one thing that would unite us all as humans, it would be a common enemy that isn't one of us. And that is this virus. You know, I still hold out hope that we can unify and that we can come together and recognize that all of us are equally vulnerable to this. But unfortunately, and it's not just in the United States, parenthetically, this has become a polarizing topic that I have no intention of getting involved in or talking about. I have my own opinions, but that's not necessarily something I think that you tuned in to hear tonight. I want you to please keep an open mind. I will not ask you if you've been vaccinated. And frankly, if you've decided not to get the vaccine, that is your right to make that decision. I'll be clear that I disagree with that choice, but my job tonight, I promise you, is not to convince you to get a vaccine. We'll certainly talk about some of the attributes of this and maybe allay some fears. But if you feel like this is just going to be me wagging my finger at you for an hour, I promise you it is not. And then the last thing I'm going to ask you to do is recognize that there is very little in life that is black and white, that there is always some degree of gray, that there is always potential risk. And that every decision that we make in life, the decision to just walk outside in the morning, comes with certain degree of risk that we learn to accept. And so in some way, thinking about these vaccines is part of how we calculate our own sort of life risk. Okay, roller coasters. So where are we? I have my lovely assistant who's right across the dining room table. Eileen, can you share number 1? Let's see if this is going to work.
While we are waiting for the sharing, I just also wanted to announce currently you all are able to unmute yourself. I took the liberty to mute people that weren't muted, but you can unmute yourself. If that should become interfering with Glenn's presentation, I will mute everybody, but for right now, you all have the ability to unmute yourselves if you want to ask questions once Glenn gives you permission to do so. That can happen.
Yes, I want this to be interactive. You surely don't want to be listening to me for just an hour straight. So I suspect you all know this curve pretty well. This is the number of cases of SARS-CoV-2, or the number of cases of COVID, since the beginning of this thing, which began somewhere around the end of February. So I don't know if my arrows work, but each of the lumps, it is remarkable to me, looking back on this, that first lump way back at the beginning of February, this is when we were all panicking. This is when you could hear doors slamming shut, toilet paper being whisked off of shelves for inexplicable reasons. And look how relatively low that is, how naive we were a year ago. Now, each of the next lumps correspond with a very specific point in time. Anybody want to take a guess what that lump, the small one in the middle there is? Eileen, can you point to that one for me? That one? What does that coincide with?
Easter.
Nope. That's the 4th of July. And those next three, 1, 2, 3, do we know what those are?
The holidays.
Thanksgiving, Christmas.
Labor Day, Christmas, Labor Day, Thanksgiving.
Well, it's actually Thanksgiving, Christmas, New Year's. Boom, boom, boom. It couldn't be, I mean, it is so textbook here because the number of cases correlates with when people sort of say, you know what, I'm done with this pandemic. I want to see my family. I'm going to go to a barbecue. And I promise you, back in January, exactly where Eileen's cursor is right now, all of us who were virologists were truly despairing, because look at the left side, 200,000 cases reported per day in the United States alone, 200,000 new cases per day. Now, look where we are now. So, or at least, yeah, as of a couple of days ago when I collected this. So we feel better, and indeed, relative to where we were in January at the top of that terrifying roller coaster, we're far better. But actually, if you kind of look to the left, where that correlates with is somewhere around Halloween of last year, right? The number of cases, around 70,000 new cases per day, is somewhere around Halloween. So not nearly as good as it was in July and August. And it certainly is far higher than it was when all of us were the most terrified of this thing way, way, way back in February and March of 2020. But I want to show you a different curve. So Eileen, if you wouldn't mind, show number 2. Now this is the same map, but now this is the number of deaths. And I want you to try and remember that other one, because this curve looks similar in some ways. You see the lumps and they kind of correspond with where they were before. But you're going to notice a really interesting difference here. Anybody want to point out what I'm trying to refer to that's a very big difference between the curves of deaths and the curves of cases?
We're lower than we were before.
The initial bump is higher
Yep.
than the second bump.
Yes. On a per day basis, the death rate has decreased substantially. And that's good news. I am not going to argue in any way that there's a dark side to this. That is purely good news, right? Look at how steep the death curve was back in February. Remember, that curve was not particularly high, but the number of deaths, and of course the scale is different. This is 2,000 versus 200,000, but the number of deaths per day was far, far higher earlier in this pandemic than later in this pandemic. And that's probably due to 2 things. Number one, the age of the people who were getting infected. Back then, it was mostly the elderly who were getting infected. So people that had lots and lots of comorbidities, other conditions, who were not immunologically fit. Now, the groups that are getting infected are younger people in their 20s and 30s. And even though this infection is still extraordinarily serious for people of that age, those people generally have, relative to the very elderly, more robust immune responses. So that's one of the reasons why the death rate is decreasing. But the reason why I went through this whole exercise with you is to make a point. You are looking at what medicine can do. Back in February, and I told you about my little tour of Gene's Hospital ICU the last time, I think when we were on, didn't I? I'm seeing Paul nod his head yes on this. So one of the most horrific experiences of my life to go over to that ICU. And I remember, as I think I said the last time, the attending saying, I don't know what to do for these patients. These people were just dying in the ICU because we had no medicines, we had no interventions, we had no way of providing support for them. Now we do. Now, if you get COVID, we have drugs that work. We have antibody therapy that works extraordinarily well. We have blood tests that we can tell you when or if you're likely to be heading down a wrong road. So I still want to prevent people from getting COVID. It still is an extraordinarily serious infection, but the opportunity for medicine to intervene now is far, far different than even just a year ago. And so it is to highlight the power of medicine, right? The idea that, and I've had absolutely nothing to do with this, so I can, sort of heap praise on them because none of it comes back to me. The idea that medicine, sort of physicians, scientists working together came up with strategies that are going to actually save lives of individuals who already have COVID is remarkable. It is the same healthcare system that is the group of folks that came up with these vaccines. So I promise you, even for people who are against vaccines, which we're going to talk about in a bit, even for those individuals, if they land in the hospital with COVID, they will say yes to the therapies that have been developed over the last year. It feels a little contraindicatory that these are the same, some of these are going to be the same individuals that say, no, thanks, I don't want the vaccine. All of it borne by the same sort of community of physicians and scientists trying to make this infection go away or to make it better in those individuals that get infected. So where are we today in the infection? So Eileen, you can go ahead and close that out. I have two more little graphics and then these are all going to go away in just a second. Not quite yet. Just hang on just a second. That's okay. You can open it. That's fine. We're going to get there in a second. So leave it up. That's good. So is it good or bad? So certainly the rates are lower than they have been. There are certain states, and you're living in one of them if you're in Pennsylvania listening to this, where the rates are increasing. And the rates are increasing because the weather is nice and people are just tired of the pandemic, and this virus doesn't care if you're tired of it. And so, rates are going to continue to increase. You cannot fool this virus. You cannot sort of sneak around the side of this. And even though it is indeed true that there are fewer deaths, death is not the only way in which we measure the impact of this infection on people's lives, right? So we know that, for example, there are individuals who are long haulers, which we can talk about, where for the vast majority of people, they get sick, they get better, takes a month or so, but they slowly improve. There are some people that just stay sick. We don't quite understand what's unique about them, but they do. There are other individuals that have persistent lung challenges. So especially if you already had COPD or you're a heavy smoker or other lung conditions, there are people that even though they are completely free of this infection, still are suffering the side effects of this. And so it still can have a substantial impact on your life, even if this infection doesn't kill you. Okay. The last thing before we open this up to see what questions you have just about where we are in the pandemic and about the virus is a little bit about variants, because everybody is just like, oh, the variants, and whether vaccines are going to be responsive to these variants. So you can all see me, right? And not just Eileen's thing. Can you see me over here? I'm getting a thumbs up. That's very wonderful. So I have a demo for you. So just standard piece of paper. See if this is going to work. So this, I didn't do this last time, did I? Okay. So this is what a protein looks like. Okay, just think about it like a crumpled piece of paper, right? It's three-dimensional and it's got all sorts of like little nooks and crannies and contortions on them, all right? And you've heard about neutralizing antibodies, which are one component of immune memory. And so what these antibodies do is they bind to very specific, I don't know if you can see my little paper clip, but they bind to very specific regions of this crumpled, complex looking ball, right? So each of these paper clips here is, think about it as a different antibody binding site, okay? We know that the spike protein, that is the protein that you are vaccinated with if you end up getting the vaccine. You also make an immune response to the spike protein if you were infected. The spike protein has about 20 of these little sites that paper clips can bind to, all right? The variants that exist, and there are many of them, and they are here. It's not sort of, still in Kent or in Brazil or in South Africa. They are on your street, I promise you. But it's not something that you have to freak out about, because these variants are changed in little ways that probably at most remove one of these paper clips. And remember, if I had the time, I'd put 20 on this guy, because there are approximately 20 particular sites that these antibodies can bind to. The variants maybe make one of these sites go away, but you're still left with 19. And these vaccines in particular are extraordinarily potent and good at inducing these neutralizing antibodies, my paper clips in this model system here. So the reason why I think you don't need to be too nervous about the variants is, even if you're infected with one of these variants, if you've been vaccinated, you have substantial coverage, right? The thing that we would worry about, of course, is a spike protein that is completely invisible to these neutralizing antibodies, right? That would be what's truly terrifying. But the thing is, that would require so many mutations in this protein that this protein could no longer function the way it needs to in order to allow the virus to continue to replicate. It almost becomes just mathematically impossible that you would end up having such a stealth variant that it would not be detected by any of the existing vaccines that are out there, or frankly, your own host immune response if you were to have gotten infected. So the variants are important. They matter. They are more infectious. That's true. They might actually make disease a bit worse. That's also possibly true. But it does not mean that you are exposed to them if you've gotten one of the vaccines. The vaccines are still quite protective and effective. Okay, so let me just take a stop here and see if you've got questions just about either the rates of the pandemic or the infection itself. We're going to talk about the vaccines next, and then we're going to talk about crystal ball stuff at the very end. Any questions so far? Or do we start talking about cows?
We get it hurts.
Eileen just got the cow thing. It's good. Glad she's paying attention. All right, we're good. I see some nodding heads. You're welcome to come off of mute. I become insane if I just hear myself talking. So I see thumbs up. That's good, but feel free to just interrupt me or ask questions. All right. So here we go. We're gonna take apart what you think about herd immunity. Okay. Everyone is talking, and it's making me a little wacko here. Everyone is like, well, when we reach herd immunity, then ... something happens. And it doesn't work like that. Herd immunity is not a number that something magical happens when you achieve that number, right? It is just a point along a process. And moreover, we actually have no idea what level of the population needs to be immune, either through vaccination or natural exposure. We have no idea. The estimates are somewhere between 70 and 85%, which is a fairly generous range, but that could be incorrect entirely. It could be as high as 90, it could be as low as 60, nobody knows. And part of the frustration is that we're misunderstanding what herd immunity means. The concept of herd immunity originated with herds. So now think about a pasture with a bunch of cows in it, right? So you have this image. Those cows are a herd, and the only other cows that they get to see are the other cows in that herd, right? They all go out to pasture together. They do whatever they do during the course of the day. They wander back in, and they do it day in and day out. It's not like, on Saturday night, Bessie ducks out of the barn and goes to visit the next herd, down the street. This herd is a completely closed community. And therefore, the concept was originally designed, of herd immunity, was originally designed to talk about groups of animals in which, if you had, let's say, 80% of that herd was vaccinated, the 20% that wasn't vaccinated is still protected, because the 80% that are vaccinated form this, almost think about it like an immunological wall around those couple that are not vaccinated, right? It's not like something magical is happening. If all of a sudden now the virus is able to penetrate that wall and get into that community, those 20% that weren't vaccinated are absolutely going to get infected. Okay? So what's a herd of humans? Is it St. Paul's? Is it Abington? Is it Southeast Pennsylvania? What quantifies, what constitutes a herd of us? Well, my argument would be a herd of humans is called humanity, right? And so, Eileen, if you could show number 3 here. Thank you for being so helpful here. So this is, as of just a couple days ago, the percent of all residents in the country who've received at least one shot of the vaccine, right? And so it's good. Look where you are in Pennsylvania, greater than 40%, actually probably greater than 60% by now. But look at the rest of the country. Yikes, right? And as soon as barriers and boundaries open up, as soon as we start all actively flying again, and somebody from, and I'm going to pick on Wyoming because it looks like it's one of the lowest, but you know, Louisiana is not doing so well either. As soon as infected individuals from those places enter your herd of Glenside, of St. Paul's, of, you know, whatever your herd is, if you're not vaccinated, it doesn't mean that you are somehow magically protected because everybody else around you is. The protection is afforded only insofar as nobody else enters your herd, right? And the moment that we start having world travel, now you end up, that's why I make this point that herd immunity, what a herd of humans is all of us as humanity. So Eileen, if you go to my last graphic, number 4. The last one, so do you know that about 50% of humans have, or sorry, of Americans, about 50% of Americans have actually been vaccinated. Do you know what percent of all humans have been vaccinated with at least one doses? Anybody want to hazard a number?
3%.
What'd you say, Connie?
I said 3%.
Connie Campbell knocks it out of the park every single time. It's about 2.7%. 2.7% of all humans in the world have received at least one dose of the vaccine, right? So when you sort of say, well, I've had my vaccine, can I take my mask off now? The answer is probably not yet, right? Because if we think about all of humanity being the herd in which we belong, given world travel, given how much people move from place to place, and given how still great a need there is to vaccinate all the rest of us, we're not there yet. We're on our way. And that certainly is compelling and positive, but we're not there yet. The United States, we can say with some degree of pride, I think, is leading other countries in vaccination. If you look here at total reported vaccines administered per 100 people, you know, the United States is pretty orange. And the only other places where it's super, super good is in Britain. There's a little chip in Israel that's such a small country that you can't see it, but that thing is, you know, deep brown. And then there is whatever the country that is right by Saudi Arabia. What is it?
Qatar.
It's Qatar? Okay, thanks. Yeah, my geography, not so swell. So, okay, Eileen, you can close that off and no more graphics. You just get to look at me now. So when we think about herd immunity, again, it's really important to recognize it's not some number that magically, it's not like, you know, ringing the bell at the carnival where you win if you hit the bell. It is a gradual process. The more of us that become immunized to this thing, ideally through vaccination, but infection works as well, the more we build that wall. And that is going to be true for the entire community of us as humans. So when we think about, you know, our neighbors, it's not just people down the street. Okay, so roulette wheels. So let's talk about the vaccines. So somebody, please be brave and tell me what you know about the J&J vaccine, the newest one that's out.
Hey, it's Leslie.
Hey,
So,
Leslie.
So the J&J vaccine, as far as you want to know about it itself, or what are the complications with it?
Just tell me one little thing that you know about the J&J vaccine.
I know that in terms of what they've been saying, that the risk is, it is so astronomically low about the risk of having blood clots that it almost defies logic. But I completely understand why they put the brakes on it. They want people to have faith in it. But truth be told, had I not gotten the Moderna vaccine first, I would have gone with the J&J without question.
Mhm.
I know that it's different in terms of how it goes at the virus. It's not an RNA, not an RNA vaccination. But the fact that it's more tweaked for the variants that everyone now is so afraid of really turned my head. And again, look, I'm just glad that I've had mine, but I look forward, quite frankly, to when they turn it back on.
Yep. So what most people, so that was a really thoughtful answer. Thank you, Leslie. When most people are asked, tell me what you know about the J&J vaccine. And I get this at the Cancer Center all the time, where people come up and they're like, I got the J&J vaccine. Tell me about these blood clots. To me, the lead story is not the blood clots. The lead story is that of 7 million people that have been vaccinated with the J&J vaccine, 6,999,994 of them are fully protected against lethal COVID, right? That's the success. There are 6 individuals, all women, all young, it's kind of a bit of a mystery, who've come down with blood clots. And they have paused the vaccine, which I think is a sign that this is working, right? The idea that you would say, hang on, there seems to be something happening. These blood clots are unusual. They are similar to some of the blood clots that were initially seen in the AstraZeneca vaccine that was paused some months ago. And to be able to say, well, let's just be sure before we vaccinate other people, let's do a little bit of in-depth studying and see whether these vaccines are somehow connected to these blood clots in an extraordinarily small number of people, less than 1 in a million, is thoughtful and wise and what you want from a healthcare system, right? It's not that this vaccine is broken. It's not that it doesn't work. And I argued, I think I said, maybe I said the last time, I'm not sure how on the horizon the J&J vaccines were, but my prediction, I'll make 2 predictions here. Number one is I'm betting you that the J&J vaccine is going to be back in supply by the end of the week or early next week, and that people will be able to get it. My second prediction is it's the J&J vaccine that's going to save the world. And what I mean by this is the Moderna and the Pfizer vaccines, the ones that perhaps you all have gotten, are finicky. They're sort of precious, right? They have to be kept at super cold temperatures. You need 2 doses of them. They're a little diva kind of vaccine. Johnson & Johnson, you can keep that thing in the refrigerator. It's 1 shot and you're done. And so, when you think about how we have to vaccinate the entire human population, people that aren't necessarily a quick drive away from Abington Hospital or a Walgreens or a CVS or a Fox Chase Cancer Center, but people who are perhaps far away from a clinic, the opportunity to come back 2 times is a major impediment. So these single shot vaccines, AstraZeneca, the Johnson & Johnson, some of the ones that were developed by Russia, China's is not so good, but the Russian vaccine turns out not to be so bad. These are both 1-shot vaccines as well. These are the ones that I think are going to get us well past that 2.5% to a place where we can sort of put this virus and this pandemic behind us and to rest. But we as humans always over-focus on the risks, right? It's the reason why people buy lottery tickets, because they think, well, somebody's got to win. It's the reason why people might often say, not Leslie, but why people might often say, oh, I don't think these vaccines, they cause blood clots, and therefore I don't want this thing. When in fact, it's 1 in a million, not certain that they cause blood clots. And 1 in a million is extraordinarily rare. I tried to come up with one analogy that didn't have to do with something grisly like, your chances of getting in a car accident are better or hit by lightning. Here's a good one. It is a 1 in a million chance that within the next 2 minutes from now, a president of the United States will be born. Of all the people that are born in the United States, over the course of the next 2 minutes, it's a 1 in a million chance that one of those individuals will become the next president of the United States. And if that's true, I wish her well. The point is that these vaccines are all safe. And this argument, and it's a little bit annoying because it feels like a trope now, but if you've not been offered a vaccine, first of all, if you've not been offered a vaccine, do me a favor, just send me a little email. But if you have not been offered a vaccine and somebody says, would you like the Johnson & Johnson vaccine? I think the answer is unequivocally yes, because it's going to be the thing that protects you against this pandemic. And of note, this infection, for serious infections, causes blood clots in 1 of 60 people. And that is a number that is worrying, right? Not the 1 in a million, but the 1 in 60. So what questions might you have? Because I'm going to almost be done with my comments, and then we can spend some time talking. Do you guys have specific questions about vaccines? Or do you want me to finish up on the prediction stuff, and then we can just leave the last 20 minutes or so together to answer questions? Maybe do that. Finish me yakking.
I have a question.
Yep, go ahead.
So, and we've talked about this at work, and of course, I understand if you don't know the answer. But so now we have 3 vaccines out there. Like you said, most of us have, so anyway, so we have the J&J, Pfizer, Moderna. Now you're hearing rumors of, you might and I don't know if it's just the Pfizer, they might have to get a booster. And then do you foresee in the future, is it going to matter if we need to be revaccinated? Does it matter what vaccine you get at this point, if you've been initially vaccinated?
Yep. So I think it is reasonable to think that at some point down the road, you'll need to get a booster. My bet would be that you won't need a booster for at least another year, if at all. One of the benefits of the Pfizer and the Moderna vaccines, because these are RNA vaccines, and we talked about this the last time, so I'm not going to repeat all of that, but they're very simple. These are the most, kind of streamlined, straightforward, pure vaccine types that have ever been made. And so it's really easy to swap out the RNA that encodes the spike protein of the original strain. And if now, let's say there's a new variant that has taken over, the B117 strain, for example, the one that came from England, it is relatively straightforward to make a booster that now includes that spike protein, just to make certain that you make a good, effective immune response. So yeah, I think this pandemic is not going to just disappear overnight. We will get to a point where we're going to be living normal lives in the midst of this in the midst of this virus still being there. But it's going to be with us for many years to come. That doesn't mean that your life is going to look like it does now for many years to come. But it's going to take a while before this scourge is pushed all the way back into the cave and we don't have to think about it. And while it percolates throughout humanity, it is possible that you will need to have an occasional booster. I think that is a reasonable possibility. There are effectively no differences among any of the vaccines. I mean, the Moderna and the Pfizer are so similar as to not be in relevance to us. I mean, they're different in terms of the dose of RNA and how cold they have to be, but they perform exactly the same function. And frankly, so does the J&J. And all of the vaccines, the Chinese ones, the Russian ones, all of them are targeted to the spike protein. That's my ball with the paper clips. That's the thing that is going to give you the most robust immune response. So it's not recommended now because we haven't actually tried this. I would have no compunctions, no fears at all if my booster was of a different vaccine flavor. Your immune response isn't going to care. So if you got Moderna and then a year from now you get boosted with a Pfizer, it's not like your hair is going to catch on fire and you're going to your toes are going to fall off. You'll be absolutely fine. It will just remount your immune response. What else about the vaccines? Anything else? We're so quiet tonight, St. Paul's. All right, well, let me finish oh, go ahead.
Question that I have, what makes the difference between the Pfizer and the Moderna, that the Pfizer is for 16 and older and the Moderna 18 and up?
No difference except the groups in which they were tested, right? And there's also a difference in timing. The Pfizer is a 3-week interval. The Moderna is a 4-week interval. My apologies if I already said this, but think back to when the folks at Moderna or the folks at Pfizer had a vaccine and they had to think, all right, we're ready to try this in humans. We're ready to do clinical trials. So this was back in probably May, because the vaccine was developed very, very quickly, May of 2020. And they realized a lot of people are dying. A lot of people are losing their businesses. A lot of people are freaking out. So we have to hurry along these clinical trials, not to cut corners on safety, but they couldn't try lots of different variants, right? They couldn't say, sorry, I use the word variants in a different context. I don't mean to be confusing. They couldn't try a lot of different approaches. They couldn't say, for example, well, in one group of people, let's just try 1 dose. And in another group, let's try 2 doses separated by 3 weeks. And in another group, let's try 2 doses separated by 10 weeks. They didn't have the time to be able to do that. So they sat around a table and they said, all right, we got to pick one. Let's go with what we think makes the most sense. And this is before any of them knew that they had a grand slam on their hands. So it was kind of just random choice that one is separated by 3 weeks, the other is separated by 4 weeks. One of them tested it down to 16-year-olds, the other tested it down to 18-year-olds. There is otherwise no difference between these whatsoever. And parenthetically, for those of you that have kids or grandkids and you're wondering when they're going to get vaccinated, all of these vaccines are currently in clinical trials with kids all the way down to 12 and some of them even younger. I think the expectation or the hope is that we can get kids vaccinated before the school year begins in the fall. That's, I think, the expectation. I wouldn't be surprised if you start seeing vaccine data coming out about kids sometime in June, July. All right, let me do my crystal ball and then you can all unmute and I can hear somebody's voice other than my own. So when can you stop wearing masks? And I'm going to frustrate some of you and say, not yet, please. At least not in public. And now you might say, well, hang on. You just told me that if I'm vaccinated, I'm safe, I'm protected. Why can't I take off my mask? And I think there are maybe 3 reasons for this. First of all, these vaccines are, without question, the biggest scientific advance, I think, in any of our lives. The speed and the efficacy of these things is borderline miracle. They are 95% effective. I can't tell you another vaccine that is that effective. But what that means is they're 5% not so effective. Now, 5%, I'll take those odds any day of the week, right? But that's still 1 in 20. Now, that doesn't mean that 1 in 20 people who have been vaccinated are going to end up coming down with COVID and being on a respirator and running the risk of dying, because actually all of these vaccines are 100% effective at keeping vaccinated individuals out of the hospital. But there is still that opportunity, that slight chance that if you were vaccinated, you still could get infected. It would be a low level of infection. You might not even know it. But if you're wandering around not wearing masks, the opportunity for you to transmit it to somebody else, even if you just happen to, accidentally cough or you were in the midst of a conversation at Giant or at Wegmans or wherever you were, the possibility that you might transfer that to someone exists. It's not a high possibility, but it's a possibility. And so until we actually have enough of all of us vaccinated, I think at least in large scale public settings, wearing a mask is the appropriate thing to do. I told you I had 3 reasons. I think the second one is that it hasn't been formally ruled out, and this is a variation of the first, I'll admit, but it has not been formally excluded that even people who are effectively vaccinated might actually still ferry virus from person to person. There was a report that came out very recently, and it was a geeky science article, but it said that the way that this virus is transmitted is through aerosol. And this is actually important. It means that if you've been washing your green bean cans when you get it home from, you can probably stop doing that if you want to. The chance that you're going to get infected because, some snotty kid at McNeil's, put the green bean can on, what is it? O'Neill's, whatever it is, picked it up, and now you're going to get almost 0%. I mean, the scientist is never going to say never, but I'm going to say, no, you're not going to get COVID from a green bean can. But what we thought for a while was it was transmitted by droplets. And droplets and aerosols sound kind of the same, but they're not. Droplets, when you sneeze, when you cough, those are the big, heavy, liquidy droplets that kind of come out of you and they're just, gross. That's not how this virus gets spread. It gets spread through aerosols. Right now, I'm generating tons of aerosols. The mere fact of breathing, of talking, generates aerosols that, if I were infected, would percolate out into the environment. And why that's important is that you don't necessarily know who's infected just because they're, snurfling along on the 2 pews behind you and you decide you want to move over to a different part of the church, right? That it could be someone who is stealth infected. And for these reasons, as number 2, it still is wise for you to wear a mask because you might not know that you're infected. And the third reason is because of optics. And I know that that may not be particularly compelling, but Eileen and I must say, one of my favorite things of this pandemic is the discovery of how much I love Wegmans. Every Sunday, Eileen and I schlep what is a long way, all the way up 611 to go to Wegmans. And one Sunday afternoon, we were there and there was a woman who didn't have her mask on. And it was remarkable. I mean, the looks that this individual was getting, right? We don't yet know who's vaccinated. We don't have little stickers that say, don't worry, I'm safe, I'm vaccinated, versus those people who are just protesting that they're tired of wearing masks. And so therefore, choosing to not wear a mask in public is going to contribute to, at least for a while, some degree of confusion. So I think for a while, you still need to wear your masks. But I think that there are things that if you're fully vaccinated, you can do. And I hope you are doing them, right? It took a while to get into this pit, and maybe some of you are really scared. And I want to be careful here because I don't want to recommend something that backfires for you. But I don't think I would advise this, or I would say this if I felt like I was putting anyone at risk. If you've been vaccinated, that means both doses, and it's at least 12 days after your second dose. Go find a friend. Go out to dinner. You can even eat inside if you want, right? You can give them a hug if you want to. You can see your grandchildren. You can have people over to your house and you can take off your masks and you can make, nachos and slurp it up. There's a lot of things that you can do once you're vaccinated that won't put you at risk or won't put people around you at risk. You can come back to church. Henrik, I promise you, did not tell me to tell you this, but the 8 a.m. and the 10:30 services are back. And it is, when Eileen and I go, it feels like I'm back home again. Come back to church. It's fine. And bless her heart, Julie Sullivan's there pretty much every Sunday with her little temperature gun just to make sure that all of us are safe. So all the things that you've missed doing for the last year or so, once you're vaccinated, you can come on back. It would just be the request that certainly in church and in other places that are more public, that you'd continue to wear your masks for a while. So when can you perhaps take your masks off? Well, and I'll shut up in just a moment here, and that'll give us about, I'm happy to stay on longer if there are more questions, but I want to be respectful of your time. So vaccine rates in the United States are increasing by about 0.7% per day. So we're vaccinating about 3 million people each day. And the country is somewhere around 330 million people. So each day, the rate increases. Right now, we're at about 27% who are fully vaccinated. And you probably have heard that at least 50% of adults have received at least one dose of the vaccine. So I actually did a little bit of math. By Memorial Day, we will have greater than 50% of adults in the United States fully vaccinated. And by the 4th of July, it'll be greater than 75%. And even though I just kind of dismissed the idea of herd immunity, truthfully, it's not like you're hanging around with people that are flying in from lots and lots of other places. You're hanging around with your neighbors or with your family who probably didn't do a lot of traveling. So my guess is that by July, August, we're going to slowly begin to climb out of the pit. And I use that as a metaphor here because it took us a while to get here. It took us a while to get used to this, looking at Zoom, that all of you now are like, oh, Glenn's talking tonight. We log into Zoom and boom, we're ready to go. Remember how hard it was when you first started. Remember how terrified you were. It took a while for you to kind of climb down into this really weird new normal. It's going to take you a while to climb back out of that same pit. And there's going to be a period where all of a sudden, you're going to kind of feel uncomfortable about something. The first time you go out to dinner, wherever it is, you're going to be like, oh, this is kind of weird, but you'll be okay. And the second time, it'll be a little less weird. And the third time, less again. And the same is true with any of the things that you do habitually, whether it's, going to church or eventually, hopefully the arts will open back up. Oh, I can't wait. So then eventually we'll be able to move back to this. And there's going to be a point where people are going to recommend, okay, if you want to take off your masks, you can. And it's going to be your decision whether you keep it on or whether you would choose to take it off. And I think we can tolerate a whole latitude of individuals. My guess is that once we start vaccinating kids in the summer is going to be our chance to climb back out. And I am deeply hopeful that after Labor Day, the world begins to look a little bit more like it did before this pandemic. It'll have felt like a really long time for you. But let's remember, this is your second pandemic. You've actually lived through 2 pandemics. Do you know what the other pandemic is? Anybody want to take a guess that's not my wife?
Polio?
Nope.
Ebola?
Nope.
AIDS.
AIDS.
Oh, AIDS.
HIV. You are still living through this pandemic.
Mhm.
Now, this is a virus that you catch in different ways. And so therefore, it may not necessarily, it may be part of your reality, but it may not be part of your reality. But believe me, that was as much of a global pandemic as anything. And that thing started back in the 1980s. So that pandemic rages on. If you sort of think that pandemic has been with us for 30, 40 years, a year and a half for this pandemic is a minute in time. It is remarkable how quickly we have been able to suppress this. But it does, I will admit, require the participation of all of us, because so this is going to sound a little finger waggy, I'm sorry. So if any of you have not been vaccinated, you can put me on mute for the next minute. My opinion about not getting a vaccine is this is not like driving without your seatbelt. If you choose to drive without your seatbelt, that's a bad choice. And if you get into an accident, the only person, though, you're putting at risk is yourself. Choosing not to get a vaccine is more like driving drunk. You're putting yourself at risk, but you're putting everybody else around you at risk here as well. And a decision to not vaccinate yourself is not just something about your own health, but you are also impacting the very people that you would spend the most amount of time with, your loved ones, your elderly friends, your elderly relatives, your kids, your grandchildren. You put all of them potentially at risk, which is the reason why I'm kind of militant about the importance of getting yourself vaccinated. But as I say, I think by the end of the summer, I'd be surprised if even at St. Paul's, we're not mask-free. That's my prediction. That's my hope. So what can you do while we wait? And I try and put this into every one of the talks that I give. And if I said this the last time, my apologies. I don't remember what I said. And it was really kind. I want to actually thank Ethan, because I had a little conversation with Ethan, and then Ethan asked permission to include it in his sermon. So I'm going to say it again, because I can't emphasize this enough. First, if you've been vaccinated, good. Now, get others to get vaccinated, right? Be an ambassador for this. Talk to other people and don't just lecture to them, but listen to what their concerns are and then explain to them why you got vaccinated. Be part of this change. Be an ambassador for people getting vaccinated. Secondly, use this as an opportunity, to Ethan's point, I guess coming initially from me, but this idea of make a difference while you can, right? 20 years from now, this pandemic will be in our past. And wouldn't it be great to be able to say to your kids or your grandkids when they say, well, did you live through the great pandemic of 2020? And you can say, yep, and you know what I did? I did this. I worked at a food bank. I gave blood. I volunteered at a vaccine clinic. I worked at St. Paul's Food Pantry. I did something that was helping to make the lives of people who are suffering from this. And that doesn't just mean those who are sick, it means those who are financially strapped as well, helping to make their lives better. So use this as an opportunity so you can look back once this is all in our rearview mirror with some pride that it was better or quicker because of your actions. So sorry for my little lecture, but I will stop. We've got just a couple minutes if you need to tune out because, I don't know, Matlock is on television, or I don't know, I don't watch TV very much. I will not be offended, but I'll stick around if you've got questions or if there are things you want to ask or talk about. I promise I'll tell you if I don't know the answer, but we'll figure it out together. So what do you want to talk about?
Glenn, I just want to make one quick comment, and that is because I want to avoid people showing up at 10:30 on Sunday. We only have the 8 o'clock person in person right now. The 10:30 service will go back live on Pentecost, and then following the summer services 9:30, we will be in person from then onward.
Sorry, I misspoke. Oh, and I'm going to put in a plug for another thing, but it is absolutely relevant to this. It's my other hat at St. Paul's. We're doing the Faith in Action grants again, and if you look in the messenger that Laura is going to be putting out fairly soon, as I wrote in the little blurb for Faith in Action grants, if there was ever a year where we realize we depend on each other, it's been this past year. So please, please feel free to put in and, ask for the moon, because we didn't have a Faith in Action program last year. So consider putting a Faith in Action grant that might be one of the ways in which you help to make a difference. Sorry, Henrik, I didn't mean to misspeak about the services. Okay, questions?
Glenn, I have a friend who wanted me to ask you, really, because she couldn't be here tonight. Is it okay, and I think I know your answer, to not wear a mask at an outdoor concert if you're spaced apart?
Maybe.
Not one of these gigantic, not like the Beatles or something.
If you can make, it's interesting, right? Because it's all a matter of what does that look like? If you said, is it okay to go to an outdoor barbecue in a park? I'd say, yeah, I think that's probably fine if you're vaccinated. But the concert, I don't know why that kind of got me a little bit more anxious, because I'm thinking, all right, people are lined up in rows. Depending on what the concert is, you might sing along, right? If it's James Taylor, you might belt out, and now here come the aerosols. And so it changes the risk level slightly. I think me speaking personally, and all of us have different risk levels, and it doesn't mean that one is right and the other is wrong. For me, when I go back to a public venue where I'm going to be sitting in rows, it's probably not one where I'm going to be screaming along with the singer, which I think everyone will appreciate, for those of you that know my brief and terrifying moments in the church choir. So I probably will not be, hurting anyone's feelings if I don't join in, but I'm going to want to sit there and be, kind of quiet as we are, for example, at church. So yeah, but there is some risk to that, I think, Pam.
Okay, thank you.
We good? Did we answer all your questions? I think there's something in the chat. Let me just see it, make sure none of them are questions.
And I'm kind of curious as to how long these aerosols hang in the air
Yeah.
after someone speaks or whatever.
Hours and hours. They really do. It's amazing because the heavy ones, the droplets, are gross, right? I mean, they're wet and mucousy, but they're heavy. And so they are impacted by gravity. So they come out and down they go. These aerosols are extraordinarily light, right? So sometimes like when you see a beam of light coming through the beam of sunlight coming through, you see these particles that almost like mysteriously are just floating in the air, unimpacted by gravity. That's exactly what these aerosol particles are like. They can stay in the air for long periods of time. They actually don't come out of the air. What happens is they dehydrate, which is one of the reasons why people end up getting, well, it's a little complex. You get sicker by some things in the summer, sicker by other things in the wintertime for different reasons. But these aerosols can actually last in the air for hours and hours. However, to that point, they also dissipate over time. And in order to get infected, it's not just a matter of breathing in one virus particle. You need to have a fairly hefty dose. Nobody knows how many virus particles, but probably hundreds of particles. And if I sneeze or if I speak and I'm infected, those particles over time are gonna dissipate broadly. And it's unlikely that somebody who walks in the wake of me speaking 2 hours later is going to get enough of a dose to get infected, most likely.
How many particles approximately, like when you sneeze or cough, do you dispense?
If you're actively well, it depends on the virus. If you're actively infected, it ranges from millions to billions in one good snort.
Wow.
Yeah,
we talked about it's Elaine.
Yep. I see you, Elaine.
Okay. We talked about the need for additional vaccination, and I've heard people talk about the fact that we might have to get vaccinated for COVID annually. Is there any truth to that?
Nobody knows, but is that
Well, we do the flu shot annually.
right, and the flu shot's very different. So at some point, for the true geeks among you, I can opine about the differences in the flu versus COVID, but the influenza virus is a really different, how it replicates, how it grows, how the genetics are set up are unlike any other virus that humans or even animals can be infected with. And for those reasons, we need to have annual flu shots because it cannot just mutate quickly, but some of these different pieces can kind of swap in and out almost like Lego blocks that are interchangeable. That isn't true for COVID. So my guess is we probably are going to need a booster, but just because this virus is so prevalent throughout the world, and perhaps because over time, our immune responses are going to wane. But over time, by that, I don't mean weeks or months, but probably a year, maybe a little bit longer. And what you want to do is put a little more, sort of immunological gas in the tank to get your levels back up, because that virus is still going to be out here a year from now. And what you don't want to do is find yourself caught short because your immune response over that year has waned. And that probably is the reason why you need, I guess, one booster. But I don't, to me, that's not that big a price to pay. I mean, it's just line up, get another shot. Nobody loves a shot, but if that's going to prevent me from, the horrors of COVID, okay, I'll take the shot. So I think my guess is that we're going to each need another booster at some point, probably in late this year or early 2022. And that might be enough. But a little bit of it is up to humanity, right? If enough of us get vaccinated quickly, that's how you vanquish the enemy. Otherwise, it'll take longer.
Mm-hmm.
Glenn, I have a question. It's Leslie, and really it's more about Caroline being a singer. So she has already had her first vax. She got Pfizer last week.
Mm-hmm.
So once she gets her second, and then she's 12 days out from that.
Mm-hmm.
I mean, she can belt it through a mask now, but would she be able to sing without a mask? Like, are her aerosols then still a risk? if she's fully vaxxed?
Right. So I think it's all about minimizing risk, right? As I said at the beginning, nothing's ever black and white. But if Caroline was vaccinated, and if we didn't have, if people weren't like sitting, 3 feet away from her in rapt attention, because your daughter has a beautiful singing voice, if they weren't like super up close to them, but she maintained a sufficient distance, I think I'd be okay with that. Now, the decisions that St. Paul's makes, I'm part of that, but that includes, Paul is part of this, Jason, Julie, Henrik, Rayanne. It's a collective decision, but I would be supportive of slowly bringing back singing without masks for those people who have been vaccinated, as long as we're able to ensure a reasonable distance between the singer and everybody else.
Thank you so much.
I've got a couple questions.
Sure.
Okay, so the first one's a little like out there. Do you foresee us like creating and testing vaccines specifically for animals?
Against COVID?
Yeah, because like, do you remember back in like October, November, a bunch of minks over in Denmark all got COVID, so then they had to kill like 2/3 of the minks, and then there was a mink shortage. So like, we know it spreads to different animals. Do you think there will be some type of defense developed for them?
What a good question. You ask really good questions, Connie, and I'm not just saying that. So one of my favorite questions that I've gotten at Fox Chase, when the pandemic first started, people would email me lots of questions. And one of my favorite questions was from somebody who wrote to me without any context: is it safe to adopt a cat? And I think the rationale there was that she had heard that maybe tigers got infected somewhere else and worried that a cat is a sort of tiger. I don't know exactly what it was. I wrote back to her and I said, no, not because they are going to transmit COVID, but because cats are awful. And she didn't write back to me. So I think I made her go away. It's a really good question, Connie, because I'm not sure that the vaccines that work for humans, would they? They probably would actually work pretty effectively for animals. Now, we don't know, when you have so many people who are infected, you end up having these kind of one-offs where like maybe a dog got infected, maybe some cats got infected. It certainly doesn't seem, at least to my knowledge, that animals are a major carrier of this. I mean, it probably originally came from bats, but a whole lot of people don't keep bats as pets. But like in terms of like what you'd want to vaccinate against, I think the vaccines that we have probably would work for animals as well. You don't have to, there's nothing human specific about these vaccines. So presumably you could actually use them for animals. I think the bigger question is that worth the effort of vaccinating so many animals at great cost when they're not really likely to be, at least to our current knowledge, major carriers? But it's an interesting question because for a lot of viruses, humans are not the only ones that carry them, right? Influenza, it's swine flu, avian flu, because birds and pigs get infected and transmit them too. And we certainly know from every time we take our dogs and cats to the vet, they get vaccinated. It's another $150 for a whole bunch of new vaccines because there are viruses that are specific to animals. This one I don't know about. I don't think it certainly doesn't spread with the speed that it does in us as humans. Did you have another question, Connie? Because your questions are fun.
I do, but I think I have to wait until there's less people because it's about like specific symptoms with the vaccine. And
Sure.
I think my mom will get mad if I TMI everybody.
No worries. I'll hang in there and we can talk later. Anyone
I
else?
have to go, and I just wanted to say thank you, Glenn.
Oh, you're welcome.
Thank you so much.
You're welcome. And anytime, truly, I've said this before that I feel like I'm happy to be able to answer questions. So if something comes up and you just want to send me an email or give me a call, you can find me in the directory. I am more than happy to have an individual conversation with you if it will either give you more information, maybe put your mind to rest. I'm happy to do that. It's sort of a privilege for me. So let me know, okay? And if you're not a member of the church, you can just call the church, and Laura, Henrik, feel free to give out my phone number if somebody who's just tuning in by chance wants to reach out. Okay. All right. Well, thank you guys for hanging in there. Hopefully this will be the last one of these you will hear from me. And I will see you at church, I hope, at some point reasonably soon.
Thank you
Thank
so
Glenn.
much.
Thank you. Thank you.
Thanks, Glenn.
No worries.
you.
My
Thank
pleasure.
you. Thanks.
I will stop the recording now.